Hello you, welcome to Hospital Psychology in Practice. Today we are going to talk about grief. Grief is loss. Real loss occurs through the death of a person, an animal, loss of a job, an object of sentimental value, loss of housing as in environmental disasters. Symbolical loss refers to life changes, the end of a relationship, the loss of a sports competition, the passage from childhood to adolescence, from this to adulthood to old age. Loss produces a break, a cut, a withdrawal of something that was linked to you. Overcoming loss is preserving a remnant of what you lost in order to continue with you. Something must stay with you. That is why there are those who keep objects, photos, adopt a different behavior that reminds them of what they lost. The person who died does not leave the mind of the bereaved. The absence will be felt forever. It is necessary to experience the suffering of mourning, which is normal and healthy. You have to make room to release the suffering. Whether it is crying, ask yourself 1,000 questions about life, have insomnia, get nervous, isolate yourself, each in their own way. The time of mourning is personal and will appear days or months after the loss. It can last for months or years. However, it is necessary to talk a lot about this loss to give a new meaning to the suffering, preferably with a psychologist. Grief is not a disease, but when a person denies it and lives as if nothing had happened, it can explode sometime later in an unhealthy way. The literature indicates that if the mourning lasts for more than 2 years with symptoms of hallucinations, constantly seeing the deceased, outbursts of emotion, strong desire for the deceased to come back to life, loss of interest in daily activities, insomnia, isolation, impersonating the person who died, caring for a doll as if he cared for the deceased, requires evaluation by a psychiatrist for possible pharmacological support. Every experience depends, accumulates, and is relieved in future losses with great potential for illness. The end of mourning occurs through the integration of the self with what was lost, and the person begins to make new connections, new interests and desires in life. And little by little he goes about his daily tasks without stopping his life, reduces suffering even with the present absence. At the next meeting we will talk about self-annihilation. See you later!